Hi, Dr. Burhenne here of AskTheDentist.com. So today we're going to talk about something that a lot of people ask about, a lot of patients ask about, and that is, do I need a crown? I've been told I need a crown, but I'm worried it's going to look funny, it's going to look fake, it's costly, it's expensive, it costs 3 to 4 times as much as a filling. Why can't I just have the filling done? And will it hurt? And why does it take 2 visits and I don't have time for 2 visits? I mean, there's a lot of concern of having a crown done, and I totally get it. I've had a crown done. I'm the one administering the technique for providing a crown. I totally get it. And I just want you to know that it is a difficult question, but I'm here to help. And that's what we're going to talk about today. There are essentially 3 reasons you need a crown. One is, first, maybe the most obvious, is you've had a root canal. And in dentistry, if you've had a root canal tooth, that almost automatically requires a crown. And let me explain why. The tooth is not living anymore. The inside of the tooth has been removed due to infection. And because of that, the tooth does not have the opportunity to remineralize and defend itself anymore, and it will desiccate, it will dry over time. So the rule of thumb in dentistry is within 6 months, especially on a back tooth, and especially if you're a grinder, get the tooth covered with a crown. The crown will protect the tooth and prevent it from splaying open, cracking under pressure when you're grinding and chewing. So if you've had a root canal, it's pretty straightforward, and the insurance company also thinks so. Get the crown done. It's pretty straightforward. The second reason is trauma. This is a little bit less straightforward, but people that grind a lot, if you get to the age like I am, I mean, you're going to have some damage to the teeth. It's a good thing to get to that age, but your teeth will need some repair. So if you have a little bit of a split in a tooth or a little crack, that crack is going to continue to splay or spread over time. If you put a crown over the tooth, that crack will stop in its tracks. It will not splay anymore. If it splays long enough and far enough, the root will, the nerve inside the tooth will be affected, and then you'll need a root canal, which obviously means, and you know where this is going, you will need a crown for that reason alone. The last reason is, and I'm going to put 2 things in this category, deep cavity and big filling. And they're kind of the same thing. A big filling is going to be a deep cavity, and it's going to be very close to the nerve. So again, if you get too close to the nerve and you harm the nerve, if the filling is so large that it's almost, well, in dentistry, the rule of thumb is if it's greater than 2/3 the width of the tooth, you're going to need a crown because the tooth has become weak because the volume of the filling is so large and it's taken up a lot of the tooth. So that is a good indication for needing a crown. So if your dentist has discussed these 3 things with you, then you definitely will need a crown. So what are the other concerns about getting a crown done? One is, how will it look? Will it look natural? Will people know that I have a crown in my mouth? And that's a very valid concern. And there are lots of options in that area, gold and the many different types of porcelain. And if done properly, a porcelain crown will look as good, and in some cases better, than your natural teeth. And so I wouldn't worry about that, but have the discussion with your dentist and make sure he knows or she knows that you want something that blends in with all your natural teeth. Is it painful? A lot of people think this is a big deal because it's 2 visits, and the first visit is about an hour long, and that's twice as long as a filling appointment. It's the same type of anesthesia as if you were getting a filling done. There's a little bit more grinding involved, but it's sometimes in many ways more superficial than a deep filling. And so whatever pain you're used to feeling or discomfort, or if you feel nothing after all that, which is typically what you should be feeling, that's about it. That's what you're going to feel. It's about the same. Make sure your dentist uses a lot of water spray when he's cutting the tooth. That will help later on. The function of the crown. The function of the crown is going to be great. A well-made crown functions exactly like a natural tooth. It flosses the same. It prevents food from getting caught in there. It's sculpted. It's a piece of artwork that's handmade by a lab technician that is designed to look and function as your natural teeth do. How long will it last? A lot of people are, concerned that they're spending more for this procedure. Well, how long will it last? And in fact, it will last longer than a filling, sometimes 2 to 3 times as long, depends on what kind of crown and how you take care of it. But they can last for a long time. And then the last thing is cost. maybe that's the first thing that people ask, and that's valid. A crown will cost 3 to 4 times as much as a filling, but as I said before, it's a better investment over the long term. And dental insurance will pay 50 to 60% of the cost of the crown. So to wrap things up, this is what I want you to remember. A crown is like a helmet for your tooth. It protects the tooth and it prevents from loss of the tooth and your teeth in general. So don't be afraid of needing a crown. It's part of living. Things break. It's an easy procedure that allows you to save your teeth. Thanks for watching this video, and I look forward to seeing you in the next one. Please leave us comments as well.